On behalf of the forum, as well as our partners at Revive, welcome and thank you for joining us for Engaging Nurses, Lessons from a Time of Crisis. Workforce is the #1 issue facing healthcare organizations today and potentially for months or even years to come. Nowhere is this issue more acute than with the critical audience of nurses. COVID-19 burnout, skyrocketing labor costs, traveling nurse issues, and thousands leaving the profession are all taking their toll. In today's webinar, we'll examine how healthcare marketing and communication executives can help address these challenges. The speakers you'll hear from today are Beth Toner and Chelsea Rice. Beth is a Senior Communications Officer at Robert Wood Johnson Foundation. She has more than 25 years of experience in marketing and corporate communications. She is also a registered nurse with clinical experience in long-term care and community health settings. In her current role, Beth provides strategic communication support for programs that equip 21st century leaders and researchers from all sectors to help build healthier communities and practices. Beth finds her work at the foundation to be the perfect blend of her two passions, communications and healthcare. Chelsea is an Associate Director of Content at Revive. Chelsea joined Revive after a career as a journalist and digital strategist, tackling content and communications from a variety of angles in healthcare for over a decade. She helps clients build narratives that connect with their communities wherever and whatever form those stories may ultimately take. A couple of notes before we begin. First, attendees are participating in listen-only mode, but we welcome your questions. If you have a question for our speakers, simply enter it into the question and answer pane located at the bottom of your screen at any time. We'll also be conducting an interactive audience poll during the webinar. Be sure to participate by clicking on the answer that best reflects your situation. Now, I'll turn the program over to Chelsea to kick us off.
Sorry about that. Thank you everyone for being here. I'm excited to discuss what we've learned about engaging nurses with the Robert Wood Johnson Foundation. And here's just an overview of how we'll get there. We're going to start off with the lay of the land and then focus on the nursing workforce and what we've learned. From there, we'll move into how we approach tackling these issues and why you should care to implement these learnings as a communications professional. So yeah, and stay tuned for the end for your Q&A. So please keep your questions or drop them into the chat when they come up. But we're hoping we'll have fun today. So unless you've been living under a rock lately, this isn't news. The healthcare industry is facing a labor and staffing crisis for sure, The Surgeon General himself has laid out how the crumbling workforce is a national emergency. And you can see in the statistic, there's just an enormous gap between those leaving positions in the next 4 years and the significantly smaller workforce anticipated to replace them. And a big issue in the overall staffing crisis is one particular workforce, in particular, of course, nurses. And I'll hand it over to Beth as a nurse herself to dig into this.
And, you know, after 2.5 years on Zoom, still remembering how to unmute. Thanks, Chelsea. Of course, you all know this. I'm not telling you anything you don't know. And yes, I'm a little biased because I'm also a nurse, but nurses are the keystone of so much of the care that your patients in your system receive. I'm sure none of the statistics on this slide are news to most of you. But I actually don't think it's possible to overemphasize that the nursing workforce has been hit particularly hard by the pandemic and the fallout from the pandemic. Let's be honest, being a nurse is a great job. I'm glad to have chosen it as a second career. It is also a really hard job. It was hard before the pandemic. COVID only made it harder. I know you can read, so I'm not going to read you all these statistics. I do want to emphasize the double bind that we're in. We know we have nurses leaving the profession in droves, not just because of the pandemic, but because our nursing workforce is aging. We also know that based on what we're seeing, that today's new nurses will leave their jobs far too soon. I think this will only get worse as nurses who were students during the pandemic, who were often forced to learn through simulation and not with real hands-on experience. I think that they will have a tough time transitioning to practice. If you don't know or aren't sure of how the nurses in your system are doing, that's a problem. Chelsea's up next with suggestions on how to find out. And then I'll share some of our findings about what we found when we talked to the nursing workforce. Chelsea?
Yeah, so here's a little check-in for all of you. We're gonna offer an audience poll here and just see how you all are doing with your workforce. So how concerned are you about the nursing workforce at your organization? Either very concerned, concerned, somewhat concerned, or not sure. And we'll just give it a little bit of time to give people a chance to answer. And maybe if you haven't done poll on Zoom before, or if you forgot how to poll, like I forgot how to unmute at the start of this talk, give you all the grace to let you respond here. But we are curious to see how connected, you know, as healthcare marketers and communications professionals, we are with the nursing workforce at our organizations that we represent. All right, so the results are in. It shows that 73% of you are very concerned, 24% of you are concerned, 2% of you are somewhat concerned, and 0% are not sure. So I am relieved that there aren't any people who are not sure, because we were going to say, if you're not sure, that may be a real cue for you that your marketing communications for your brand is a little disconnected from your nursing workforce. So I'm glad that we're all on the same page here. Obviously, you're concerned about this issue. You probably wouldn't have tuned into this webinar if not. So while Robert Wood Johnson, pivoting back to our work at Revive. So while Robert Wood Johnson had worked with nursing leaders for years, this was a real pivot moment for them when they decided to tackle an audience that was more challenging to reach, and that's the everyday nurse, the folks working on the front lines. And so step one for Revive would be to deepen our understanding of these nurses, who they are, what they care about, and how they communicate. So it was time for us to pull up a chair and listen to what they had to say.
Thanks, Chelsea. Yeah, you know, as Chelsea mentioned at RWJF, we had a well, I thought we had a pretty good handle on what I call the nursing elite, as Chelsea mentioned. But we also know that if we are going to drive our mission of health equity forward, we really needed to engage frontline nurses, just because there are so many of them and they have such close contact with patients. So as all of the communications partners focusing on this work sat down, including the folks at Revive, we decided to listen in a number of ways. And I think I really want to emphasize just how important it is to hit a number of different ways of listening. We had held focus groups. We did one-on-one interviews with nurses. We did social media monitoring. If you aren't doing social media monitoring in the nurse space, you need to start doing it. We did quantitative as well as qualitative research. We identified several nurse archetypes, along with insights about the culture of nursing and the perceptions of nurses among healthcare leadership. What we found really helped shape our thinking about the next steps in the engagement process. So let me share our first finding, which is that, first of all, and having worked in a long-term care and clinic setting, I wasn't surprised by this. And you probably aren't either, but nurses regularly experience adverse working conditions, bullying, and I call it for what it is. We nurses have still not gotten past our culture of bullying, sexism, racism, patient violence, and it's causing them to consider seeking a job away from the bedside. Again, I'm not going to read all these stats verbatim, but I'll point out that these stats were only 9 months into this pandemic. The situation has most assuredly gotten more dire since then. Secondly, at RWJF, we believe, and this is why we funded a second report on the future of nursing, that nurses, wherever they work, can play a key role in advancing health equity and ensuring patient outcomes improve for everyone, particularly among populations that have traditionally been marginalized in our society. Very few healthcare providers, as I said, spend more time with patients than nurses, and nurses approach their patients with a very holistic perspective. Not only that, nurses are trained to and want to, because they are so mission driven, to have an impact on their patients and their community by not just healing those who are ill, but working to address upstream drivers of illness and injury. And you can see that in these statistics. But the problem is the pandemic, it was hard before the pandemic, and the pandemic has made it even harder than ever for nurses to do that. So we needed to know how we could start that conversation in an authentic way. And Chelsea will share what we learned there.
So part of elevating nurses to be change agents for health equity is creating spaces where they have authentic conversations, connections, and support one another. So our research absolutely revealed that nurses are craving that authentic conversation with each other in spaces outside of their jobs. This probably isn't news to you. We're seeing nurses all over social media kind of giving their voices to things that they're seeing at work. So you can imagine how that can be a direct correlation to opportunities they're not given at work to share these perspectives and, to vent or to share what they're seeing on the ground with the people that maybe could make a difference on the floor. So you can see this quote from one of the focus groups, that it's overwhelming because when I have a patient who's hurt or crying, I want to be able to sit down and just say, tell me how you're feeling. I went into work to have a human connection, to be able to give part of my heart to someone who is hurting. So we've all heard actually about nurse bullying, just like Beth was saying, but can you imagine a lot of that is probably happening because when many of us are stressed, we're operating like in a lizard brain mindset, right? We're almost purely emotion driven and a primal fight or flight response. So we really should be creating opportunities for support and connection to help nurses heal and feel like they aren't alone if they want to change things. And nurses are really unique in that there aren't as many systems of governance and support opportunities as there are for physicians and maybe other people in the workforce. When you think about healthcare, physicians are often rising through the ranks much faster and given opportunities to be a part of the hospital committee or governance boards. And nurses have historically had less of those opportunities for their voices to be heard, not only at an organizational level, but even at a community level. When you think about nurses running for public office and things of that nature, there are less nurses, there are more physicians doing those sorts of things.
Thanks, Chelsea. I think too, I want to emphasize, just kind of tagging on to what you said, don't underestimate the impact of the moral distress that all healthcare providers in your systems are experiencing, particularly nurses. There is nothing worse than getting into a job to deliver compassionate care, being trained to focus holistically, and then not having the time or the system set up to do it. And then if you raise your voice to say, hey, this isn't working for me, nurses particularly often find themselves retaliated against. And that's, I think, why, and I want to just emphasize again, social media listening is so important because they're taken to social media. They're also voting with their feet. And so don't underestimate the power that nurses have when they collectively get really ticked off. So just want to emphasize that. So we came away from our research knowing that nurses are passionate, which, by the way, I already knew, but it was nice to have that qualitatively and quantitatively backed up. They are trained to and want to drive change to improve the lives of their patients and their communities. But we had to find a way to talk with them about that in a way that didn't seem preachy, because plenty of people preach to nurses, or, give them just one more thing to do, because that wasn't what we wanted to do. So Chelsea, you get to tell them the amazing thing that the creative team at Revive came up with.
Yeah, so we really needed to build a community. And so Shift was born. This is an online community for nurses to listen, read, laugh, cry, think, and talk about big issues together. We like to say that we believe in the power of community because we know that we say, yes, you can shape the future of nursing, but no nurse can do it alone. So the content we produce for social media, our website and podcast and film are all aimed to support nurses and help nurses share their stories and learnings with one another. And this is all baked into sort of what we believe is the therapeutic nature of storytelling. There is research done and studies done about nurses who were given sort of 90 seconds at the start of their shift to tell a little story about how they're feeling that day. And there's a real difference that can make in their emotional well-being and outcomes. So hearing your feelings reflected back to you, that is community. Hearing a story similar to yours shared helps create safe spaces. So Shift is where we try to do that every day. And here's a little taste of the brand.
I'm telling all the new nurses, you don't have to take your NCLEX because this is the real
Yes.
deal.
Yeah, you'll learn today for sure.
You're going to learn today.
It's great when I'm walking into work and someone's clapping and I go up to the floor and half the floor is crying. The floor is on fire. So why is everyone outside clapping? You need help.
Definitely teamwork involved and necessary to get this job done. You've got to have a good team, and communication is key.
We have to have a voice. We have to find that voice. And the best way to find that voice is to really be well educated on what we're going to speak about so that we can clearly articulate issues that are facing us.
And if there's ever a time for nurses to come out stronger, it's during this pandemic where we can finally own the innovations that we have put in place to save patients' lives.
We all just really love that video. The music just like always hypes me up. But you can see how we're really trying to capture an energetic and authentic nurse's voice there. And I just love what Rebecca loves. She was a guest on season 1 of the podcast when she says that if there ever was a time for nurses to come out stronger with the innovations that they've come up with during the pandemic and to see their voices and stories shown, it's now for sure.
And I just want to add, I think, and Chelsea, I'll let you share some of the statistics and feedback, but I think what was really gratifying for me was the feedback I got from other nurses, right? I think I'm super attached to this project and really engaged with it because I was part of the process. But when I hear other nurses engage in it, I sent it to my sister and she texted back. She's like, this is great. This is real talk. We never hear this kind of real talk. Now, okay, so you can dismiss my sister because she's biased. She's my sister. But when I shared it with other nurses and nursing students, they engaged with the content in a way that confirmed that nurses really want that kind of conversation. I even found myself previewing the podcast episodes on my daily training walks and thought, wow, I wish I'd had these nurses' advice when I was making the transition to practice. I say about our podcast host, I wish she had been my preceptor. I might have stayed in clinical bedside nursing for a lot longer. So Chelsea, you can share some of the successes we've had too.
Oh yeah, of course. I mean, thank you for sharing those more personal responses. I mean, that is like really where we're seeing the shift response is in these DMs we're getting. This one nurse leader was sending us a comment about how she is absolutely needing something like this. We love hearing the comment, the 5-star comment. We are a 5-star podcast, by the way. And it's like therapy, right? I mean, I think that's really what we were trying to create for the nursing community, is not just a way to send messages to the nursing community. No, it's about them sending messages through us to each other and really fostering that shared storytelling connection. So you can see the over 30,000 podcast episode downloads, that was in the first year. And we've been running since then. We're now into our second year, well into our second year. Almost 1 million social media engagements, 4.6 million video plays. And that's before we launched a documentary. So this is all you can see how nurses are responding exactly how we hoped they would. And they're really finding it to be a supportive space to hear authentic stories like theirs. So anyway, nurses, yeah. And I just wanted to also say, it really is important for nurses to feel heard. And we just love hearing that they are feeling heard from this work. So Beth, did you want to tease up our next big segment?
I'll kick off and then you can play the trailer for folks. So, we talked about, Chelsea and I have both been talking about the importance of nurses feeling seen, feeling heard. The team at Revive said, hey, what why don't we take the next step? What about a documentary showing, right, rather than telling how everyday nurses can have an impact on health equity and health outcomes, on disrupting the impacts of structural racism and other isms in our healthcare system. So that's how Who Cares, a documentary about mental health nurse practitioner Whitney Fear was born. Chelsea, let's show them the trailer and we'll talk a little bit more about it.
If you own a pair of Crocs, even though you know they're super ugly, you might be a nurse.
I'm Whitney Fear. I'm a psychiatric mental health nurse practitioner in Fargo, North Dakota. I'm Lakota. I grew up in the country on the Pine Ridge Reservation. I see patients across the lifespan for treatment of mental health conditions and substance use disorders.
I don't think she's ever given herself enough credit for the impact that she makes on other people.
Yeah, she's tolerable.
She is going to have vulnerable conversations with people in a way that makes them feel like they're cared for.
I always say it's the essence of Whitney. You have to just understand how really good she is.
Asking people how they want their care and what they think is possible, because that is communicative of respect rather than compliance.
Riding in my Indian car.
So as jazzed as I was about Shift when it launched, I'm even more jazzed about this documentary, and we will share the links. I know what I think is so amazing about this documentary. I talked about, most of the nurses on the podcast being nurses I would have liked as preceptors. Whitney Fear is somebody I would love to work alongside, and she shows not that doing her job is easy, but that it is a natural part of her passion as a nurse, and has shown how, she is Lakota. She knows both the assets and struggles that her tribal nation and other indigenous peoples bring to the healthcare equation. She shows us how she gets it done all in the course of her workday, right? And that's the power of storytelling. I think what's been particularly gratifying, we've been talking about this, is that Whitney herself has told us just how important it is that this process has helped her, but not just her patients be seen, not as a population group, right? Which is what we often talk about, but as human beings. So again, be sure to watch Who Cares. So what does this mean to all of you? I imagine that some of you are thinking, why should we care about this? Chelsea.
Oh, sorry.
No, it's okay. And we can go to the next slide. So if you want to provide, if you want your health system to provide the kind of care that it wants to deliver, right? Because it drives those positive Press Ganey scores. And let's be real, because it's the right thing to do, you need to engage nurses authentically. We know turnover is costly, and it's getting more costly. The way nurses care for patients makes it either harder or easier for you to market your system. They are instrumental, they are key in delivering on your mission, and how they feel and experience the workplace makes a huge difference in the quality of care your patients receive. Which leads us to the next natural question. How can you make an impact? Chelsea is going to start by sharing some suggestions.
Yeah, so I think we started off our talk from this place as well, but Beth mentioned earlier the research we all did. We didn't just talk to one group or do just one survey. We try to reach nurses at all levels and at all different ways. So as healthcare marketing communications professionals, I think it's really time for us to get outside of our offices or roles, our traditional roles, and start engaging. Healthcare marketing is way more than just service line marketing, right? It's about your brand and about creating touch points with your workforce and making sure that your culture and your internal comms is just like as locked in as your external comms. So think about talking to your colleagues, your HR leaders and recruiters, your nurse leadership, but most importantly, the nurses themselves about what their experiences have been lately. How have the past 2 years been for them truly? And make sure you have a deep understanding of the relationship between your nurse workforce and your nurse leadership. Make sure you're creating a space where they can speak to you authentically and not feel like maybe there's a big brother situation going on, and make this a regular part of what you do. It's not one and done. And of course, their experiences are variable. This pandemic is ever changing, and so is a nurse's day-to-day life. So make sure this is a regular pulse you're taking on your organization's culture. And the nurses are going to speak to you directly and honestly about what they're seeing. And that's why I think we all respect nurses so much. And then try and be a partner with your CNO or your chief nursing officer. Think about ways for nurses' voices to be heard more organically and their passions to be tapped into. And those stories can be told at your organization, because that can really be a really powerful internal and as well as eventually external branding effort. But just make sure you're authentically listening and taking the time. And then this is all about including nurses in your overall mission. So nurses talk to each other. They also talk to their communities. If you think about it, like, who are you going to for a recommendation on what hospital to go to? You're going to your nurse who is a friend, right? And she's going to tell you exactly what she's hearing from other nurses about the hospitals in your community. So if you're working towards a mission that nurses can believe in, that they want to work for, it's really important that those conversations that are happening behind the scenes are positive. And so, like we said before, nurses are very mission-driven individuals, and they want to be a part of a mission that's making a difference in patients' lives. And so they, especially thinking about this big topic of health equity that's all of a sudden is emerging into our conversations in healthcare as healthcare marketers as well. Nurses really are going to be your allies there, and they can make a real difference in how your communities are perceiving care that they're receiving at your organization, as well as nurses being those people making that impact. Being one of the most trusted professions, they really have a voice there, and those relationships that they build with patients. So excellent nursing care can lead to improved outcomes, increased patient satisfaction, higher HCAHPS scores, right? These are all things that we care about as healthcare marketers and communications professionals. So making sure you have solid nurse onboarding is going to also engage your new staff members and align them with your mission. And then Beth is going to talk about making sure we're authentic here.
Yeah, I think if there's a, for those of you who are old enough to remember Pee Wee Herman, authentic is the word of the day. So everybody scream real loud every time we say that. If you know a nurse, you love a nurse, who have ever interacted with a nurse, we can sniff out lack of authenticity. I mean, really, have you ever watched a medical show with a nurse? They're going to tell you 12 ways to Sunday about how that nasal cannula is placed in the wrong place. By the way, most physicians never start an IV, so they're not going to start in the ER. But all joking aside, if your nurses are facing staffing shortages, don't film a recruitment commercial or a marketing commercial aimed at consumers, showing them smiling and laughing at the nurses station. Not only will your nurses roll their eyes, so will all the other nurses they talk to. Chelsea talked about it. Nurses talk to their communities. They talk to each other. They talk on social media. So if you be really clear as you go into your marketing efforts, what's authentic? Don't show representation among staff that doesn't reflect what it's really like in your hospital. And if that's a problem, start having cross-disciplinary conversations with hospital leadership, with the board if necessary. Because if you recruit nurses in with one vision and they experience something very different, it won't take them long to vote with their feet. And that's going to continue your turnover problem and ultimately your patient satisfaction. So Chelsea's going to talk about how to think about developing your strategy when it comes to the nursing workforce.
Yeah, so first of all, yeah, thanks, Beth, for that. I mean, it really is true. We talk about constantly when we're making our content for Shift, it has to be authentic. It has to be nurses telling true stories to each other. And we really try and do a lot of research behind everything we create. So when you create campaigns to bring in patients, make sure you are developing a specific strategic goal in mind. And I would advise you to think about the narrative that you want your patients to be told, and also what you want them to say to the next person, right? Think about the narrative that you want your nurses to be telling. What stories do you want them to be telling about your organization? So go ahead and think about that end result and what those stories would be. And then think about all the different ways and all the different factors that would be impacting that story, and how nurses can make a difference there. So you should be putting in the research for your patients to understand their needs, putting in the research for your nurses, understanding their needs, and treating your workforce in the exact same way that you are working to make sure your patients are having a positive experience when they come to your organization every day. So those internal and external comms should really be in sync with one another, and making sure that they're reflecting a true culture to the community and to your workforce. All right. So we are opening it up to questions. We really appreciate all of your attention so far. And Daniel, if you have any questions on deck for us, we're more than happy to jump in and see what you guys have to say, and even comments. Comments are great too.
Yeah, thank you, Chelsea and Beth, for that terrific presentation. And we do have several questions from the audience already. And a reminder that if you have a question, like Chelsea just said, you can enter it in the question and answer or throw it in the chat, and Beth or Chelsea will do their best to get you the answer. So first, maybe Beth, I'll start with you. Where do you find these amazing nurse stories?
You know, and I'm going to let Chelsea speak to this too, right? So we'll sit down. We actually do. We meet weekly, and have met weekly since we launched even before we launched the podcast. A lot of it is, we see a nurse out there, whether it's a story in the press. Chelsea, and I'll let you talk to some of the research you all have done. But also, we talked about nurses talking to each other, right? We'll interview a great guest, and then they'll say, well, I know this person, or, I've seen this person do this work. For instance, you think about just the connection. Like, for instance, I was trying to think of a really good instance. In the episode, The Floor is on Fire, the nurse that we interviewed for that had actually written an article for Stat during the pandemic, which is actually terrifically brave, because a lot of nurses were really feeling the heat for speaking out. So we interviewed her, right? Like, her story was strong, and she was also very articulate. But I will also let Chelsea talk about where you found the terrific nurses.
Yeah, so nurses like to hang out with each other, right? And on social media too, they're building their own communities, and you can often find that they're building their own relationships and partnerships with each other. So for instance, Nurse Nicole, who our podcast host, she has a whole community of people that are already engaging with her on social media. So she had recommendations of people to talk to, and it was through her that we found Pat Mac RN on Instagram, and he is just was one of our favorite guests because he's so energetic, and they also have their own relationship. So that really sort of came through in the podcast episode, as well as you can see we do a lot of cuts of that episode for social media because they're just so fun together. And then social media is a really strong place to find nurse stories, and they're really sharing and uplifting one another too. So that's a really great place to tap into community that's already forming.
That's great. Thank you. We've got a couple questions coming in now, so let's go with that. How do we can you tell us more about the sample size and the methodology of your survey? Is there a plan to update it with more current, as like pandemic times? 2020 seems like a lifetime ago.
Yeah, I need to go back. I can speak to that. We need to go back. I can go back and give you exact stats. We did do an updated study that we fielded back in May. And I think, if I'm right, the sample size was the same as the last one, which is about 5,000 nurses. And we did, as NORC did our research for us. And we focused on nurses who have hands-on patients, right? So doesn't have to necessarily be an acute care nurse, but did have to be somebody who regularly sees patients. This second survey was more focused on racism in nursing, whether it's racism experienced against patients, by patients, or, you know, more lateral violence, nurse to nurse. So less focused on the pandemic. But for sure, we're seeing the impact of the pandemic on the experiences nurses are having interacting with one another.
That's great. Another question that we've had come in, and it deals with the messaging and the testimonials that are being used currently to show culture. It's kind of a challenge. Do you have some ideas that can be used instead of the traditional sort of smiling faces of nurses in a team huddle? Thank you.
Yeah, I mean, I'm happy to hop in here. I think back to what we were talking about in terms of, first of all, you have to make sure that you're already having these conversations. I mean, I think to just kind of hop in and expect a nurse to share an intimate story about a patient encounter where they, you know, really felt like they did their job really well, or they felt like they had a really impactful contribution to that patient's life, that may not come just organically. So you have to make sure you're creating these opportunities to share those stories. But think about starting internally, right? Like, you don't have to aim for the external brand campaign first. You could be just thinking about internal communications. How can you help the nursing workforce or the nurse leadership itself elevate stars and passionate people that are trying to make a difference, and then sort of build from there. Maybe some of those stories, once they do well internally, could go to a more external branding message. But I would say it's probably more incremental. I don't think you can kind of jump off at the races.
I think the other thing is, and this is what for me, what really, and again, I acknowledge my bias towards Shift because it was part of the project I worked on, but don't be afraid. You know, healthcare is gritty. Healthcare, like, nobody signs up for healthcare to get rainbows and unicorns. You know, the glowing nurses, like, I think Chelsea's right? You have to start with authentic engagement with your nurses, but healthcare is gritty. Nurses have a dark sense of humor. And if you meet a nurse without a dark sense of humor, just let me know, right? You know, I can't tell you how many times my kids have said, do you think this is appropriate dinner conversation? So embrace that, right? And you don't have to be dark. You don't have to show patients dying, but you can show nurses working, sweating, because that's what nurses do, right? And it doesn't have to be tragic, and it doesn't have to be heroic. It can be the everyday thing that nurses do. I think so often, and I will fess up that I worked in healthcare marketing before I became a nurse. And I will tell you that one of the reasons I became a nurse is because I worked in 2 healthcare systems. I think so often we fall back on kind of the trope of the compassionate healthcare provider. You know, and that's okay. But I think showing the grit is, particularly if you're thinking about attracting nurses to your system, showing that you understand what their job entails is huge. I'll get down off my soapbox
now. No rush. I think everybody enjoys hearing what you guys both have to say. I'm going to kind of combine maybe a couple questions here and get your thoughts on them. We've talked a lot about different mediums, you know, podcasting, you've got documentaries, social media. Out of all the channels you've explored, are there more that you've used to reach nurses? Are these the primary ones you're doing? And then are these driving people to your site, or do you have other methods and means to sort of create that engagement?
Sure.
Yeah.
I can hop in here. So just in case we didn't do a clear enough rundown. So we have a podcast, which is now, we launched our 2nd season last year this time. And then we have the documentary. And then we have articles and resources on our website that are not only content packages supporting the podcast, but also their own standalone articles, including resources for nurses and profiles and interviews about subjects like nurse bullying and PTSD, and trying to compile resources to help nurses deal with some of these issues. And then our social media, we have an Instagram channel, we have Facebook and YouTube. And on Instagram in particular, even if we don't have necessarily an article that's outlining everything yet on an issue, we try and be really responsive to what's going on right now in the nursing workforce and make sure that we're compiling all these things into digestible, engaging, and our creative team just does a terrific job of making things entertaining and bright and colorful, and the emotion that comes through the imagery we use, I think is really impactful. And so it's our way of like breaking down complicated subjects as well into digestible social media, like shareable nuggets. So in terms of driving traffic to the site, I would say social media is a huge platform for us. I mean, I don't think I'm saying anything new to marketers, but Instagram is really where we put a lot of effort in terms of creating the content there. And we definitely do paid efforts there. And then on YouTube in particular, so our documentary has had over 200,000 views on YouTube, and you really saw a difference when we started doing paid boosted on YouTube through the Google ads. So that's a real way to drive traffic to the film itself. And then we're still working on converting all those eyeballs over to the website too. But really our primary goal right now is views of the documentary. And then when the podcast was our lead, the primary goal there was listens to the podcast and downloads of episodes. So we're trying to make sure that the medium that we're offering that story in is what the primary goal is around. Website views are great, but that's not really to us as meaningful as people actually absorbing the content.
That's great. Thank you. I'm going to read something from Kathleen here. She said, the quote about nurses needing PTSD addressed versus pizza parties was impactful. Amen. Do you know of any emerging best practices, good examples of systems or programs that are addressing sort of the mental health care, trauma-informed care that nurses are handling right now?
I can take some of this, and then Chelsea, if you can speak to some of what we've heard in our interviews. I think for sure it's happening, right? For sure it's happening. It's happening in fragments and buckets, right? So more siloed efforts. There's definitely been an effort in a lot of places to start collecting stories. So, as somebody who is a marketer and a writer first, before I was a nurse, I really do believe that storytelling has a positive impact on mental health. It is not the only way to get there. So I have heard of places where that kind of work has started taking place. I just talked to a public health nurse yesterday near Milwaukee, and the Milwaukee Historical Society actually started collecting stories from nurses, did oral histories with nurses who had gone through the pandemic, and she talked about just how healing that was. There has been work done around codes in trauma. So, and I am not going to be able to cite person or place right now, but and this has been a while since this has been instituted. So something called the pause after a patient is lost during a code, giving everybody a minute, more than a minute to regroup, rather than, let's take the patient to the morgue. Let's put away the crash cart. Let's clean up, right? Everybody just taking a minute to experience what they experienced. And really deal with it in a meaningful way. So those are examples. It's happening. I will say the American Nurses Association has really started to try to get at this. I think the problem is that we really need a more systemic approach to this. And frankly, I'm getting out my soapbox again. Healthcare systems need to address this in a more systemic way. That makes it okay. And part of it is cultural, right? Nurses, we definitely have a suck it up buttercup kind of attitude. That's not helpful for us. And it's not helpful for the profession, and it's not helpful for our patients. So Kathleen, I recognize that was kind of an unsatisfying answer. I think people are working on it. I think there needs to be more innovation in this space. And Chelsea, you might have more to add.
Just one example that I could think of off the top of my head is actually at She's in Scrubs on Instagram. Sarah, she has actually founded an organization called Don't Clock Out, and it's meant to be a mental health advocacy and support system for healthcare workers. And it's all in response to to them having such psychological trauma, to be frank, after the pandemic, and just being so burned out and not getting those resources at work. So that's one organization I can think of right now that is nurse founded, and she is doing it herself. And so that's a real, I think what we're all trying to see with Shift is that nurses really can be the solution for themselves if we were to give them the resources and opportunities to lean into those passions. So that's something I'd recommend checking out.
Great, thank you. This next one, Beth, maybe I'll it's kind of a statement, but I'd love to get your thoughts on this. In kind of like a rose-colored lens, or trying to put a maybe more positive spin on current situations, have you found that the current nursing shortage has had in some way a positive impact on the other nurses? Maybe that they act in a more supportive manner towards some of the new nurses?
The only evidence I would give you would be anecdotal. I think, and this is what I hear from friends who have worked ICU, and also what I see. I volunteer at 2 free clinics in my community. I think during the pandemic, there was definitely a sense of bonding, of being supportive of one another. I really saw that. I think the other thing, just to emphasize, is that while nurses can be really terrible to each other, it is definitely a fellowship in all that word entails. The nurses who have your back really have your back. And I definitely saw that emerge during the pandemic. I think the problem is, particularly now coming out of the pandemic, I hope we're coming out of the pandemic, although I fear that winter is coming. Stuff rolls downhill. And if you are stressed, not supported, you don't have the supplies you need, you don't get trained. I think about new nurses. I will tell you that, I started working part-time in long-term care. I had to structure my own orientation. And when you're stressed and you're feeling like you can't even give patients the care you need, it is really hard to not lash out. And certainly people try not to lash out, but I think, I don't know that the pandemic is going to be the long-term solve. I think nurses pulled together, but I think what it really exposed were the systems that make this kind of uncivil behavior kind of okay.
Yeah, I think that's great. I think culturally nurses are awesome. And a lot of times they're handcuffed, I would imagine, somewhat organizationally, and things that are well beyond their control. And so, I think you guys do a great job. Are there other, organizations or other tips maybe you could give to folks of how to sort of build more, positive support organizationally for nurses, or just doing more sort of sharing these incredible stories that nurses need to hear from one another versus maybe like a hospital administrator or something like that?
Sure, I can hop in. And I feel like now I'm just like saying the same thing over and over again, but nurses are creating these solutions for themselves. So there are I can probably count half a dozen Instagram handles of nurses who are deliberately creating resources for new nurses, right? Tips for new nurses, saying they remember when it was really hard for them to be a new nurse. And they're not doing this because they're trying to form a business. They're trying to genuinely be supportive of other nurses and create community. So there are actually resources out there that nurses are creating themselves to support new nurses and to support each other. And I would say that if organizations could just take a little bit of that, if they could sort of start looking outside at what nurses are doing and then see that maybe their nurses are already creating stuff like that. Maybe there is a nurse already doing something like that they don't even know about. Find a way to elevate that nurse, find a way to show the rest of your nursing workforce that we want innovators here. We want people who are building positive culture and morale here. We want people who are supporting new nurses here. That's the way that you can kind of demonstrate that, is by elevating and giving platform to the nurses that are really trying to make a difference, and making sure that they feel like that would even be recognized at your organization, and could be implemented in an organizational way, not and beyond just their Instagram handle, right? Can you imagine the opportunity that would be for a nurse who's been working on supportive resources for new nurses to have the hospital they work for be open to implementing that across their workforce. That would be huge, not only for that nurse, but all the other nurses that are watching.
Yeah, and I'd add too that, I mean, and Chelsea said this during the presentation, if you're sitting in your office, you don't know what's going on. I mean, and look, again, I was a marketing person. The only time I ever got out on the floor was when I walked from the subway to my job. But you know, and it's hard, right? I think you've got a lot of work to do. I recognize that. And it's hard to listen and work and do all the things that you need to do. But even just, you know, if you can walk through the ER on your way into the office one day, you know, take the long route, you know, hearing what nurses say to each other and seeing how they interact with one another is huge. The other thing, I will tell you from having been a nursing student, if you get a chance to talk, if you are a hospital that hosts nursing students, see if you can get a hold of one of their clinical instructors and spend a couple hours, you know, buy them lunch after their clinical experience and say, look, tell us what you see on the floor. How could we make things better? What would attract you to this hospital after clinical? Students talk. I knew which nurses I wanted to be with, right? And I knew what worked at the hospital and what didn't. So also a good place to start.
Great, thank you. We've got Chelsea, can you share some of the sites of the attendees that nurses are sharing for their experience, knowledge, and support for new nurses? I think in the chat, Debbie maybe put a few of the Instagram handles, but if you could just go over a few more of those, that would be great.
Yeah, I don't want to say the wrong handle, but there are, I think it's at New Nurse Nikki is one of them. There are a bunch that I would love to like go and pull up for you guys so you can see the exact ones I'm mentioning. But there really are many nurses that are creating supportive resources for new nurses. We even have on the Shift website, we profiled a nurse lawyer who is creating support resources for new nurses to help them advocate for employment issues or contracts that come up. We have also featured at Pat MacRN, who is someone who also regularly shares even studying tips for new nurses. At Nurse Nicole, that's NACOLE, is our podcast host, and she regularly shares tips for new nurses to around their clinicals, right? So constantly saying what she does at work, how she takes notes at work, the reference cards that she makes for herself. She's a terrific person to follow in terms of also work-life balance, being a mother of 3 children. Like, yeah, she's doing it all. So that's also someone I really highly recommend giving a follow to.
Terrific, thank you. We've got another question here. How does the work you guys are doing kind of integrate overall with the health system?
Well, I can just speak for Revive in terms of this is a real, I think, showcase for us in terms of how you can really create a cultural change and really revive an internal comm strategy. So while Robert Wood Johnson Foundation is not a health system, they are a nonprofit, but this kind of work could definitely be done at a health system led by a healthcare marketing department, right? You could launch your own internal nurse newsletter, right? Celebrating your workforce, finding stories in your health system. You could be finding those nurse stories at your health system and showcasing them externally as well too. Finding ways to sort of bring supportive resources and storytelling into your regular internal comms, I think is a really great way to integrate this work with health systems. So just think about, this is about retention too, right? Like this nursing workforce crisis is a problem for all of us, not just those that work at hospitals. It's a problem for me. It's a problem for Beth. It's a problem, you know, all of us. Our public health infrastructure is so important and nurses are crucial to that. So we really do need to find a way to support our nurses at local hospitals, but also in the community at large.
And I'll add too, you know, we have at the foundation, we have a network of nurse leaders that we typically interact with and have talked to over the last 4 or 5 years as we've been working on this and other nursing communications. And what we do with this, what we learn in the interviews that we do on shift, we regularly reach out to those folks and share what we're hearing, because we're hoping that that has a way of feeding back into the system. We're hoping that they'll share that with their leadership. So we do try to return our learning to the loop. Does it always get picked up and used? Maybe not, but we definitely like to share those learnings out.
Well, thank you so much. I think with that, we've come to the end of our program. I'm sure the audience joins me in thanking Beth and Chelsea for sharing their insights and experience today. Thanks also to all of you in the audience for taking the time to join us for this timely conversation. Please note, if you've asked a question that we weren't able to get to, we will do our best to get you a response. We'll also be sending out a link of the webinar recording in the next few days, so be on the lookout for that. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. We look forward to seeing you at future webinars, as well as the Healthcare Marketing and Physician Strategy Summit, April 17th through 19th, 2023 in Austin. Check the forum website, healthcarestrategy.com, for details. That concludes our program, and we hope you have a great day.